Story by Dr. Khaled El Kaffas, thermal ablation for varicose veins.
Ladies and gentlemen, good morning. Thank you, dear Mustafa, for your kind introduction. Now my talk today is about thermal ablation of varicose veins. It is the best treating solution. When I was first assigned by Dr. Ahmed Kamel to give this presentation, I was informed that it would be a part of debates. So which is more superior, the foam sclerotherapy or the thermal ablation? I have no conflict of interest regarding this topic. My counter-presenter today is Dr. Rana Khafagi. She's a very brilliant interventional radiologist, and she has a very good experience in varicose vein treatments, especially the pelvic veins. Now we'll start our debates. أنا عاوز أعمل من عندي أنا. هو بيقلب بيشتغلوا أيوه. Okay, we'll start our debate. So we will start by debate framing. So our core question, which modality provides better long-term outcomes for axial reflux? As we all know, axial reflux is reflux in the truncal vein, which in the lower extremity is the saphenous vein. So the factors of debate today regarding the efficiency, recurrence, complication, cost, recovery, and anatomy. So the debate focus on choosing the first line of treatment. So these different modalities will treating this patient suffering of extensive varicose vein along the course of the great saphenous vein. It will be thermal tumescent treatments as radiofrequency ablation, laser or microwave ablations, or non-tumescent, non-thermal treatments as ultrasound guided foam sclerotherapy or mechanical ablation or cyanoacrylate glue. Different modalities are performed to treat the thermal ablation. The first one of them is radiofrequency ablation. Here you can see on the left side of the screen the caster. It's a segmental ablation that we treat 7 centimeter by 7 centimeters provided by Medtronic company. Also, there is laser ablation. There is a huge amount of companies for giving laser machines, but the most important of them, like Bioelectric, Angiodynamics, or Lazo laser, you can see here the fiber is a radial fiber. The laser beam is as a ring coming from the fiber. So how thermal ablation works, it uses controlled thermal energy to seal the malfunctioning saphenous vein shunt. The vein becomes a fibrotic cord that the body eventually absorbs. Here's a quick review about the technique of thermal ablation. First, we numb the skin at the site of venous puncture. Then after numbing the skin, there is a missing slide. Okay. We use ultrasound to puncture the vein. Then we perform the most important part of this operation, which is application of tumescent anesthesia surrounding the thermal ablation caster to prevent any risk of injury or burns to the skin. Here we can see use ultrasound to localize the caster inside the vein. Then we inject tumescent anesthetic fluid surrounding the vein. Then we start the ablation of the vein either by RF catheter or laser caster. I will go quick through these videos for the sake of time. His laser ablation looks like. You can see here the laser beam is appear under the skin. You can monitor it. Then after we finish the ablation technique, we wrap the patient by compression bandages for 7 to 14 days. Now we go to our debate. So let's talk firstly about the closure rate. We have the 5-year closure rates consistently exceeds 95% for both RFA and endovenous laser ablation. This is a durable, definitive solution. In comparison to sclerotherapy, which we use foam sclerotherapy, the 3 years closure rates are often in the range of between 80 to 90%, with a clear trend towards higher recurrence over time compared to thermal ablation. So we conclude, for a definitive long-term fix, thermal ablation provides a more reliable and robust closure. There is a study performed by me and my colleagues, dated 2011. We found that the primary closure rate is 94%. So let's talk about enhanced patient comfort and recovery. What about thermal ablation? The anesthesia, as I showed you before, we perform local tumescent anesthesia. This knobs the area completely and acts as protective fluid barrier to the thermal injury. So the pain, regarding the pain, the patient feels only the initial pain pricks of the local anesthetic. The procedure itself is painless. So we don't need any type of general or spinal anesthesia. The recovery, the patient walks out immediately after the procedure, return to normal activities and work typically within 24 or 48 hours. What about foam sclerotherapy? Regarding the pain, the injected sclerosing can cause significant inflammation, leading to cramps, tenderness, and hardening of the vein with a sort of phlebitis that lasts for weeks. The recovery, while there is no downtime for the recovery, the patient often experiences more post-procedure discomfort and bruising. The safety, which is an important issue. What about allergic reaction? Sclerosants carry a small but a real risk of anaphylaxis and life-threatening allergic reaction, while thermal ablation, we use energy, so no foreign chemicals, eliminating this risk entirely. The visual disturbance, like migraine, foam sclerotherapy has well-documented risk of microemboli crossing the cerebral circulation, causing transient visual disturbance, migraines, or even ischemic events. This is not a risk with thermal ablation. The skin complication with sclerotherapy, there is a risk of extravasation leading to skin ulceration, or permanent hyperpigmentation that lasts for months or years. While in thermal ablation, we use good tumescent anesthesia, which protects the skin and surrounding tissue, dramatically reducing the risk of thermal injury and skin staining. The nerve injury, the risks are very low with a good technique of tumescent anesthesia, and that we perform thermal ablation in the thigh segment of the vein only, because as you all know, the saphenous vein is related into the below knee segment of the vein. So we conclude, by eliminating the risks of anaphylaxis and neurological events, reducing skin complication, thermal ablation provides a safer overall profile. The cost. There is misbelief that sclerotherapy is cheaper, but it is a short-sighted view. While the per-procedure cost may be lower, the high recurrence rate of sclerotherapy means patients often require more sessions and treatments over their lifetime. So when you factor in a long-term durability and patient satisfaction, thermal ablation is more cost-effective. You pay for a definite solution. So regarding the efficiency and predictability, the thermal ablation, we place the catheter under ultrasound guidance, and the energy delivery is precise, controlled, and standardized, so the outcome is highly predictable. While in foam sclerotherapy, the spread of foam is less predictable. It depends on physician's technique and patient anatomy and the behavior of the foam itself. This can lead to inconsistent results and need to more frequent top-up sessions. So we conclude that the thermal ablation is more efficient and one and done procedure with high predictable and uniform results. So according to the European College of Rheumatology guidelines, you can see here that that recommend the thermal ablation as the first-line treatment of saphenous vein incompetence with evidence of class 1A level. So let's summarize this presentation. Regarding efficiency, thermal is better. Regarding durability, thermal ablation is better. Cost, thermal is better, as I showed you before. Comfort, sclerotherapy may be more comfortable to the patient than thermal techniques. The recurrence, the sclerotherapy is more than thermal. But cosmesis, sclerotherapy provides a more cosmetic appearance to the patient. So we conclude from this presentation that thermal ablation remains the first line of axial reflux. Sclerotherapy is essential for tributaries, cosmetics, and selected cases, as Dr. Rana said. Debate reinforces complementary role rather than competition. Thank you for your attention. For further questions, you can join me at the end.
Thank you, Dr. Khaled, for this presentation. And now we invite Dr. Wasima Ali to present one varicose veins one-stop shop. And we invite you for the workshop this afternoon to see all these techniques with